actually researched low back surgeries. I mean, I hate to even say that, but about up to like 50% of low back surgeries, a person ends up with failed low back surgery or failed low back surgery syndrome. The reason why low back surgeries fail is really five. There's five reasons. One is the surgery didn't address the actual cause of the low back pain. Probably the number one missed low back condition that causes pain is injury to the sacroiliac joint. So if you had bad discs and they operated on the bad disc, but your pain was coming from the sacroiliac joint, well, that would be a reason why the surgery failed. So the treatment for chronic injury to the sacroiliac ligaments is prolotherapy. So first thing is the diagnosis was wrong. Two is the surgery made the lower back more unstable. So anybody who had a foraminotomy, laminectomy, microdiscectomy, disc surgery, it makes the lower back more unstable. So the second reason is that you had surgery, but now the back's more unstable. So you need to get stability restored, and the way you do that is to tighten the ligaments. And the treatment for that is comprehensive prolotherapy. The third reason that you have failed low back surgery syndrome was you actually had two problems. Like the one problem was addressed by the surgery, but you actually had a secondary problem. Think about a loose hinge on a door. When you have a loose hinge on a door and you keep using the door, then the hinge gets looser, and then the next hinge gets loose, and the next hinge gets loose. So most people, even before they had surgery, they had the problem for a long period of time. What causes the low back to degenerate and causes all those findings on MRI is actually instability, a looseness. So what I'm just saying is that what might have started out at a looseness of L5-S1, but now it's L3-L4, L4-L5, your sacroiliac ligament. So sometimes people say, well, the surgery helped this specific symptom, like the leg pain, but now I still have chronic low back pain. So when we tighten up the ligaments, then the secondary problem resolves, and then the pain gets resolved. The next common thing of what causes chronic low back pain is that the person's doing something. The most common thing that people do is like they just end up like sitting too much. Like sitting, there's the thing called sitting disease. Like sitting is just terrible for your lower back. So the first thing people got to do is they got to start standing like when they're working, and be up more. When you're upright, the force on the lower back is about 50% less than when you're sitting. So people who have a significant pain with sitting, normally the injury is to these structures like the ligaments of the lower back. So if that's your case, then you need to get prolotherapy into your lower back. And then the fifth thing that can occur, though it's very, very rare, because people often say, well, I had this surgery, now the doctor said that I have scar tissue and it's pinching on the nerves. And I'm just saying that happens very, very rarely. But even if it did happen with somebody, if somebody has a compressed nerve, we can release it and start the regenerative process. So ligaments can be regenerated, nerves can be regenerated. So definitely if somebody has had surgery and now they have like a syndrome, that chronic low back surgery syndrome, definitely give us a call at Caring Medical Regenerative Medicine Clinics, and most likely you have one of the five causes that I just addressed, and comprehensive prolotherapy is definitely something to look into, and normally it's extremely effective for that condition.